General Behavioral Health Integration CPT Codes. At first glance, these BHI codes can be confusing and quite intimidating, but once you understand them, they are relatively straightforward. In this video, we're going to go over everything you need to know about the general BHI CPT codes to help maximize your revenue and streamline the billings and claim process for this popular program. Hey there, this is Lauren with ThoroughCare. Here at ThoroughCare, we help practices just like yours manage, bill, and streamline popular value-based care programs such as behavioral health integration. By integrating mental health treatment with primary care, a BHI program can be extremely beneficial to your patients, your practice, and your bottom line. Billing codes for BHI are important to understand so you know what is exactly needed by your insurance carriers. Now, keep in mind, the codes we'll be going over today are for general BHI. These codes are more used in the primary physician space, not to be confused with COCM codes. There are two types of codes for behavioral health integration, one for fee-service practices and the other for rural health clinics or federally qualified health centers. But before we look at the codes, let's take a look at how the Behavioral Health Integration Program works. BHI integrates mental health treatment with primary care. This program is very similar to another value-based program you may be aware of called Chronic Care Management, or CCM. BHI is a monthly service based on several core elements. These services consist of a systematic assessment, continuous patient monitoring, care plan creation and revision, facilitation and coordination of behavioral health treatment, and a continuous relationship with a designated care team member. BHI is primarily managed by the patient's primary care team or physician. That being said, a psychiatric consultant can also help with coordinated care for this program. Your patient must present at least one behavioral health condition to be eligible for this program. Behavioral health is an umbrella term that encompasses mental health, substance abuse conditions, common life stressors, stress-related physical symptoms, and general health behaviors. Now, let's actually look at these CPT codes for the Behavioral Health Integration Program. The first CPT code you need to know is the General BHI Code 99484. This is what for-fee-service practices will use to bill for at least 20 minutes of non-face-to-face behavioral health integration time. Similar to other care management programs, a certified resource or hire needs to track, manage, and log the patient's non-face-to-face time. The BHI program does need to be under general supervision of a provider. The national average reimbursement for this code lies at around $48. The other CPT code for our rural health clinics and federally qualified health centers is General Care Management Code G0511. This is that all-inclusive code FQHCs and RHCs use to bill for care management services such as chronic care management, behavioral health integration, and principal care management. Now, you can only bill for 20 minutes of time, just like 99484, but the reimbursement is higher. For FQHCs and RHCs, bill G0511 for a reimbursement of $76.94. One of the most common questions we receive here every day at ThoroughCare is if you can bill chronic care management and behavioral health integration for the same patient. The answer is quite simply yes. Medicare's rules and regulations state that a patient can be managed in both CCM and BHI. Together, both can be an effective preventative health service, allowing each to work in tandem. But it's important to note that the patient does need to agree to participate in both programs. Also, for billing purposes, you can bill concurrently each month for CCM and BHI for one patient. It is important that when billing for both CCM and BHI, you must record 20 minutes of services for each program, so 40 minutes total. When documenting that time, one thing to keep in mind is that you can't double dip time for both CCM and BHI. You can only count one time category for one program and another time category for another. So maybe you're charting during a CCM process or outreaching during a BHI process. Be sure to log that time for the correct program and not both. If you do log both, you risk a Medicare audit and that claim perhaps being denied. With all that being said, it is perfectly fine for your patient to take part in one program or the other. So now that you have a better understanding of behavioral health integration and the CPT codes to go with it, what next? If you'd like to dive deeper into BHI, there's a link below to our Learning Center. It is full of more info about the rules and regulations of behavioral health integration. We even have some tips and tricks on how to best start and run a program, and also some of the answers to the most frequently asked questions we get here every day. If you're ready to find out more about ThoroughCare and our behavioral health integration software solution, there's also a link to book us for a live discovery call or a demo to see our software in action. Don't forget to like and subscribe, and we'll talk to you more about behavioral health integration real soon.